Do Canadian employees need health benefits? Public health care versus workplace benefits. From a US perspective, it is easy to assume Canadian employees do not need employer health benefits because health care is free. The reality is more nuanced. Canada has public health care that covers hospital care and medically necessary physician services, but it does not cover everything. Prescription drugs, outside hospitals, dental care, vision care, many paramedical services, and some medical devices are usually not fully covered. That is where group benefits come in. They are not legally mandatory in most cases, but they are a big part of what Canadian employees expect from serious employers. Legal requirements versus market expectations. In many parts of Canada, there is no blanket law that says every employer must provide a private health plan. What the law does require is enrollment in provincial health insurance programs where applicable and compliance with certain rules around leaves and continuation of benefits where they exist. So strictly speaking, you can hire someone in Canada, pay them and offer no extended health benefits, and you may still be within the law. The real pressure comes from the market. In competitive fields, candidates will often assume that full-time roles include a basic health and dental package. What typical employer plans cover? A typical Canadian group benefits plan will help with prescription drugs, dental services, vision care, and paramedical services such as physiotherapy or counseling up to defined limits. It may also include life insurance, disability coverage, and sometimes health spending accounts that give employees flexible budgets. When Canadian employees talk about benefits, this is what they usually mean, not the public system they already have as residents. For a US employer, offering nothing at all can make your roles feel bare compared to domestic competitors. Small teams and startup situations. For very small teams or early stage hiring, some foreign employers start without a full benefits plan and rely on salary alone. That can work for the first 1 or 2 hires, especially if they are contractors transitioning to employee status or are unusually focused on cash. Over time, though, the lack of benefits becomes a sticking point, especially when you start competing for talent that receives offers from Canadian firms with full packages. At that stage, putting a basic group plan in place usually pays for itself in reduced churn and easier recruiting. Cross-border mismatches with US plans. US health plans generally do not plug neatly into Canadian life. Networks, coverage rules, and regulatory frameworks are different. Trying to extend a US plan north of the border can leave Canadian employees in a gray area where they are theoretically covered but practically stuck. That is why most serious cross-border employers use Canadian group plans for Canadian staff instead of forcing them into US infrastructure. It keeps claims processing and provider relationships aligned with how Canadians actually use healthcare. Cost versus value for employers. Group benefits plans do cost money, but in Canada, they can be surprisingly manageable compared to US expectations. Because the public system handles major hospital and physician costs, private plans are filling gaps rather than carrying the entire load. For employers, that means you can often put together a reasonable basic plan that feels meaningful to employees without approaching US-style health plan budgets. When you add in the impact on recruitment and retention, the value tends to look better than the raw premium numbers suggest. Perks, allowances, and hybrid approaches. Some employers mix traditional benefits with allowances. For example, you might offer a modest core plan plus a health spending account that employees can use on what matters most to them. Others provide wellness stipends that employees can direct toward fitness, mental health, or other supports. These extras do not replace basic health and dental coverage, but they let you tailor your offer to different types of employees without redesigning the entire plan every time. Impact on employer brand in Canada. Canadian employees pay attention to benefits. When they see an offer from a foreign employer with no extended health coverage, they may wonder whether the company understands the local market or plans to stay long-term. On the other hand, when they see a well-structured benefits package that looks similar to what domestic employers offer, it signals commitment and seriousness. If you are trying to build a real presence in Canada, that signal matters. Final thoughts. Canadian employees do not always need employer health benefits in a strict legal sense, but in practical terms, benefits are a big part of a competitive offer. The public system does not cover everything, and group plans fill important gaps in prescription, dental, vision, and income protection. For a US company hiring in Canada, skipping benefits altogether may save money in the short term, but cost you in hiring, retention, and reputation. If you want to understand how a basic Canadian benefits package fits into the total compensation picture for cross-border teams, you can find more plain language guidance at www.theaccountingandtax.com. If you require assistance with Canadian tax matters, our team is ready to provide reliable professional support. Please contact us at 416-283-8774 or visit theaccountingandtax.com for more information. And if you found this video helpful, don't forget to like, subscribe, and share.